So the whole idea of rebalancing is that people with bleeding disorders don't have enough of the procoagulant factors. They don't have enough factor 8. They don't have enough factor 9. And so instead of replacing what you're missing, the idea is to remove some of the anticoagulant to rebalance it.
Hello, listeners. I'm Amy Board, your host for Ask the Expert. And here's what I've gathered from our previous episode. The proteins that help clot our blood after an injury are just floating around until they become activated. And once activated, they work together to clot our blood. But now here's the kicker. How do these proteins know when to stop? Won't they just continue doing their job forever? There must be a stopping point, or else we'd all just experience thrombosis, which is clotting, by the way. A very fancy way to say clotting is thrombosis, right? But more importantly, doesn't knowing any of this matter? I mean, does it even really matter? If I have hemophilia, or my child has hemophilia, do I need an understanding of these concepts? That's what we're going to get into on this episode of Ask the Expert, Hemophilia on Balance. And thank you to our presenting sponsor, Sanofi. We are so grateful for your support. We couldn't do it without you.
#MyHemophilia Real stories powered by Sanofi. It's time to consider the whole experience when it comes to managing hemophilia and change the conversation. Explore the full story at www.myhemophiliatruth.com.
So the whole coagulation cascade is tightly regulated both in space and time. And if it's not regulated in space and time, you can get disorders where you have too much clotted and that becomes thrombotic disorders. And one of the ways that it's regulated in space and time is, in addition to the clotting factors like factor 8 and factor 9 that help you make more thrombin, you have other proteins that dampen down that process. And there's really four main ones: protein C, protein S, that work together, antithrombin, and something called TFPI. And just like if you're missing one of your procoagulant factors, the factors that help you make thrombin, you have a bleeding disorder. If you have low protein C or protein S or antithrombin, where you're blocking the making of thrombin, if you have low amount of those anticoagulant proteins, you can have an inherited thrombotic disorder where you have clots not outside where the blood vessel is broken, but in the blood vessel where the blood's supposed to be liquid.
That was Dr. Ben Samuelson Jones, a pediatric hematologist at the Children's Hospital of Philadelphia. To summarize Dr. Ben's points, the clotting cascade is tightly regulated in both space and time to prevent excessive or insufficient clotting. If it is not properly controlled, you can develop disorders like thrombosis, which we learned is too much clotting, or hemophilia, and we know, bleeders. In addition to procoagulant factors like factor 8 and factor 9 that help produce thrombin, the body also has proteins that regulate and dampen clotting. The main regulators are protein C, protein S, antithrombin, and TFPI. If these proteins are deficient, it can lead to inherited thrombotic disorders, where clots form inside blood vessels, even when there is no injury. Our bodies have such a delicate balance in terms of how much we bleed and how much we clot. I think it's interesting that balance is all about how much and where all of this occurs.
When we're talking about hemostasis and thrombosis, it's all about how much thrombin and where is it, because it's got to go to the right place and you've got to make enough of it. And if you have hemophilia, you don't.
Yeah, the balance really means that you form the blood clot where you're supposed to when you're injured and not in the blood vessel where you're not. And then when the blood vessel injured, you do form the clot and don't continue to bleed, right? That's what we mean by balance, that you are regulating your blood clotting in the right way. And as I mentioned, if you don't have enough procoagulant factors, factor 8, factor 9, thrombin, you're more likely to bleed. If you don't have enough anticoagulant factors that are inhibiting that process, you're more likely to form blood clots. And that's how the system works in general.
So why does all this matter for us as a community to know and to understand? Here's Dr. Patrick Ellsworth, an assistant professor of medicine specializing in non-malignant hematology with a focus on bleeding disorders and sickle cell disease, to share how he explains it to his patients.
They should know which factor they're missing. Like if they if they have hemophilia A, I want them to know that that's because they're deficient in factor VIII, that their body isn't making enough factor VIII. If they're hemophilia B, I want them to know that. And if they have some other factor deficiency, usually now we just say factor whatever deficiency for those other ones. We don't really say like hemophilia C and stuff much more. But I want them to at least know what it is. And so I'll explain it, whether it's von Willebrand disease or a factor deficiency or a platelet disorder. I at least explain it so that they are equipped to then kind of relay that information, especially if they're like in an ER and meeting someone who isn't familiar at all with bleeding disorder. But then again, sometimes with these therapies, I am biased in thinking that it's important for them to know why there's, a certain therapy that they may respond to or that could help them keep from bleeding. And so I at least explain it all once and then try to gauge it from there, if that makes sense. Talking about it like a balance is the way that and I think a lot of providers talk to patients about these medicines that we're going to talk about. And it's a way that, and Alice and I wrote a paper kind of about rebalancing agents. That was sort of the metaphor we took too, is that there's sort of this balance. And actually in residency, Peter Quides is a guy who, taught me a lot in residency, got me interested in hemostasis. And he did that too. He would just draw out like a little seesaw with patients and would say, okay, look, on one side, your body wants to clot. And that's like your factor VIII, your 9, your 10, your thrombin, prothrombin. And on the other side, you've got your protein CNS, your antithrombin, your tissue factor pathway inhibitor. And those things keep it from getting out of control. And we want to be in balance, like everything in the body, like the word homeostasis says, we want to be in some sort of stasis or balance. And in bleeding disorders, that balance is obviously out of whack and you bleed. And there's people who have inherited protein S deficiency, protein C deficiency, antithrombin deficiency, which is a particularly severe one, factor V Leiden, which keeps the factor V protein from being able to be broken down by protein C. That's a separate clotting disorder. And so there are these ways that nature kind of goes haywire and then, that this balance isn't struck. And so it's been an interest for a while since, the genome was sequenced that, like, hey, can we leverage these proteins that we know are there and the way they act to treat bleeding disorders, which, spoiler alert, you can.
It's exciting because we have, for the first time in quite a while, like something really new, right?
It is exciting, Dr. Redding. And listeners, I should mention, because he's one of my faves, that was Dr. Mark Redding just now. He's the best. Dr. Mark is the director of the Center for Bleeding and Clotting Disorders at the University of Minnesota. And I asked him what patients and clinicians alike are calling this new class of treatment.
Yeah, I think we are calling it rebalancing agents. I mean, that's actually one of the challenges when there's something new, because what do we call it, right? We have to have like a name that's sort of easily recognizable and something that sort of has some meaning to it, that kind of gives a feel for like what this is and maybe how it's different from the other stuff we have. And so I do think that we've kind of settled on the term rebalancing agents for the most part. I mean, obviously there's more levels of detail to it than that, but I think that's a pretty recognizable term and one we've been using for a long time now. And I think it helps to sort of understand a little bit about how these medicines are different compared to the ones that we have had prior to now.
Do you see yourself and your colleagues being able to perhaps prescribe some of these new rebalancing agents or something else for some of those patients that do have that variability? Like, let's say a male who has moderate hemophilia B, but bleeds like a severe and really hasn't found anything to work.
Yeah, that's a great question. And that's something we've already sort of had some experience with. So, for many, many years, we defined the severity of hemophilia just on the factor level. We said if you're less than 1%, you're severe. If you're, between 2 and 5%, you're moderate. And if you're above 5%, you're mild. We know that that's not the whole story. So there's a lot more that goes into what your bleeding tendency is than just your factor level. And so we've been working for quite a few years now to try to explain that to the payers and get people to understand that severity isn't just a number. Severity is what we call a clinical phenotype. All the different things about an individual that contribute to their bleeding risk have to be considered. So when we decide that someone's appropriate for, prophylactic treatment with a certain drug, it's not just based on their factor level. It's based on their overall bleeding tendency, which is affected by lots of things. And I will say that concept it took a while for people to get their heads around it, but I don't think that we're struggling so much with that anymore. At least in my neck of the woods, the payers have been very open to hearing that. And I think they understand that if a patient's bleeding, it doesn't matter what their factor level is, right? If they have a bleeding tendency that is a certain amount, regardless of what their factor level is, we need to do something about that. So I think that's really the key. It's not so much, what's your number? It's more what's your bleeding tendency, and how do we sort of capture that and articulate that to justify the use of these medicines? And we've gotten pretty good at that because we've had to do it in these last 10 years or so.
Some basic understanding, I think, does help you make informed decisions. I think the more you can understand your disease, the more informed decisions you can make about your therapeutic options. I think that's important to, the counseling and the treatments are all customized to what the patient and family should value. But as you alluded to, I think as our armamentarium, what types of drugs we can bring to bear is expanding. How you decide what's right for you is based on how it works.
Mark lives with hemophilia A. Along with spending time with his wife and their twin daughters, he enjoys volunteering and cooking. What you don't know about Mark is the impact that living with hemophilia has on his daily life. Mark bravely shares how hemophilia has impacted his relationships. He emphasizes that shared decision-making with healthcare providers, along with strong family and caregiver support, is key to managing the challenges of hemophilia. Scan the QR code or click the link in the show notes to hear Mark's full story and learn more about how important shared decision-making is for hemophilia patients and their support system.
That wraps up this episode of Ask the Expert. We explored the fascinating concept of rebalancing in hemophilia treatment. Instead of just replacing the missing clotting factors like factor 8 or factor 9, rebalancing agents work by removing some of the anticoagulant proteins to restore balance in the clotting process. Dr. Ben Samuelson Jones and Dr. Mark Redding have helped us understand how delicate this balance is and why it matters. If you have a bleeding disorder, understanding this balance could help you and your care team make better treatment decisions. As Dr. Redding pointed out, it's not just about factor levels. Your overall bleeding tendency matters too. So thanks for listening, and stay tuned for more insights into the science and care of bleeding disorders. And I'd like to thank our presenting sponsor, Sanofi, just one more time. We couldn't do it without our partners there. We are so grateful for all the emphasis that you place on education in the community. Did you know bloodstreammedia.com is your one-stop shop for all podcasts for the bleeding disorders and rare disease community? There you can find links to the Global Hemophilia Report and our flagship podcast, Bloodstream, with your hosts, me, and Patrick James Lynch. Also check out Flow, which is straight talk about extreme periods, and The Pain Pod, which is an in-depth storytelling odyssey of chronic pain. All this and more on bloodstreammedia.com, the #1 podcast network for rare disease. Have an idea for a future episode of Ask the Expert? Or have a question that you would like to hear one of our experts answer? Email us at mailbag@bloodstreammedia.com. You'll also find Bloodstream Media on Facebook and on Twitter and on Instagram and all those social media channels. I am your host, Amy Board, and until next time, stay curious, my friends.